So with the full hoop septum, we have to pry it open and then bend it shut. So there's some fancy tools on the tray, but it doesn't mean anything crazy.
Oh, so it's like a really small one and it'll just be a quick go through?
Yeah, it's actually really tiny. It's up in here, right there. And that's it. What'd you think of that, Emma? Pretty cool. I mean, less than you thought.
That was really cool.
Awesome. I'm so glad you're happier with your outcome than you thought you would be, because I know you were so nervous. Okay, and now we're just going to close that ring like I showed you earlier. It's going to pinch you or hurt you. I have my finger in there for protection. A pop-in ball is basically a pressure ball. She's happy because it didn't hurt that much. That's good. And then that's done. I'm going to hide the ball over on this side, I think. Yep. Yeah, it seems to hide better on the... It hides better on the right than the left. Take a look. Like it?
Oh, yeah.
Cool. We have Kaylin in the chair. She's going to get her navel pierced. She's had a bunch of stuff before, but for some reason she's all kind of nervous.
I'm scared.
I think you have plenty of experience and you'll be just fine. She's crying already. What are you crying about?
That was it?
Yes.
Are you kidding me?
I knew you were going to say that.
Oh my god. That was nothing.
Do you want to get your blow?
The blow? No. I'm gonna wait to do that one. I don't like getting too many at one time. I did that last time. I did nipples and nose and... I'll come back with Georgina if she wants her lip done.
I think I'm gonna come down and get the bottom one done.
You can come with us.
Okay.
I'll let you know whenever
Okay,
we go.
so could you describe the belly piercing?
It didn't even feel like a bee sting. I don't even know. It didn't even feel like anything.
Awesome.
I didn't even...
Okay. We have Elizabeth. She's getting a conch piercing. You had a belly and a tragus and stuff, so you're pretty used to stuff, but you like it when I count. So we're gonna count for you, okay? Okay, 1, 2, 3.
Ooh.
You alright?
Yeah.
Good job.
Get easier for some reason.
Aw.
But you go back for more.
I know. It's always a bad thing.
Perfect. Yeah, and you'll have a small final size so that you'll be able to pick all kinds of gold options then. Your ear is smaller, so we used a 1/2 inch diameter instead of the usual 9/16. Shopping and stuff should be a breeze for this one. All I'm doing is popping that little ball in. Shouldn't be painful, just maybe you hear some noises. And then do you want the ball visible or hide it in the back?
I don't mind.
Okay, let's see what you think of the way this one looks. If you can see from there.
It looks so good.
That's cute.
Yeah. Oh, thank you.
Yep, I'll spray it off for you. Would you rate it higher than a tragus?
Lower.
There you go.
Yeah,
Okay.
it definitely wasn't as bad as my tragus. Because whenever I got my tragus, it was my first piercing.
Oh,
And then
yeah.
my lobes,
Right, that's a...
and it was not a good first choice, but
Oh,
it's my favorite one that I have.
yeah. This one, I mean, some of them are pretty easy and just, you know, they just reopen real slick. But after 13 years, you know, we don't know how easy it's going to be, so we decided to do a little video on it. Check it out. So we're looking for that little bubble, and that's what means that it's probably there. Stick it out straight. That one actually was super easy. We thought it was going to be a brutal reopening, but honestly, after 13 years, that hole is still there. And I don't think she's in big pain because she's not really even acting like it hurts. And that's a 3/4 length just in case of swelling. It didn't even hurt.
No.
Would you have done that a long time ago if you knew that was that easy?
Yes.
Okay.
Yes, I would.
Okay.
Like long time ago.
Awesome. And that wasn't a needle. That was a taper. They're not sharp. They're just, you know, skinny at the tip. Help guide it through and then up to the size that you need. All right. Well, I gotcha. I know you're probably nervous. Anybody would be, but it's pretty simple, okay? I'm going to raise your chair up, though. I can already tell you're down pretty far. Good, looking good. It doesn't hurt that much. You'll be just fine, I promise. It's really not that bad.
No different than another piercing.
It's not that bad, really. Don't move. Good job. Definitely doable. Probably annoying, but doable is what I'm assuming, because everyone can tolerate it pretty well. There you go. Because it's normal to have a little extra saliva going on when we're doing this. Nice and tight. Here's your extra gauze. There you go. You all right? You did really good holding still and being brave. Good job.
Let's see.
You see?
It looks center.
Weird.
It feels weird. Yep. Day one feels weird. We're doing a Smiley piercing for Heavyn. She has to rinse and spit first before we would work in the mouth. It's just a way to reduce the bacteria in there. Not a big deal. I'm sure you're clean. We do it for everybody. And that's this after you spit in the cup if it feels like you need to wipe your mouth. That's all. We're going to be using a, well, we didn't measure her for the diameter yet, but we're going to be using a titanium horseshoe. We're going to check out what diameter would work best for you. So we have decided to use a 7/16. And we're going to take a look. Lean back all the way. I'll do the lifting for you, no worries. You okay?
Mm-hmm.
Atta girl. Just working for safety. I give a little dip in lubricant. It usually slides through really easy anyways, though. So this one shouldn't have been too painful, and plus, you know, it's a quick healer too. There you go. What'd you think of that one?
Wasn't too bad.
That's awesome. Though when I put the bowl on real tight, I'll be pushing back in instead of pulling outward, because, I mean, obviously, this is a delicate area. You want to put your ball on it tight. But see how I'm pushing in towards your body?
Mm-hmm.
Yeah, so when you change them, you be careful. Don't hurt yourself.
Yeah. Thank you.
Did it hurt worse than your nose?
No.
No.
It's kind of uncomfortable.
I think we got our goal of where we wanted it to hit, though. It looks exactly where I pictured it on you. What do you think? Yeah.
Yeah.
Any higher wouldn't have been as fun. So that's why she needed a 7/16 diameter. We have Zeta in the chair. She is getting a septum piercing. She chose black titanium. We're going to take a look at her nose.
I'm scared.
All three of you are getting piercings and you're all scared, huh?
Yeah.
Oh, she's
I'm
not scared.
terrified.
Oh, she's terrified.
I'm not scared.
Check out your nose.
Oh.
There's a nice thin spot right there.
Ow.
It hurt?
A little bit.
A little bit.
You got it.
Enough to say ow. Fair enough.
That was quick. Oh.
All done, honey. All done. Ta-da. Yay.
Oh god, I'm scared. Are you gonna get mine on record too? Oh,
If you
God.
let me. Look over here.
It looks good.
She can't see, right?
I'm hungry.
Did it make you hungry?
Oh, that's her. I like that review. When she pierced my septum, I felt hungry. Okay. I don't think you're going to think it's that bad. Plus, these needles that are from industrial strength, they're super slick and coated, and they're like lightning fast. So they're really cool needles. They hurt you less, and that's why I pay more for them.
All right.
Okay? So lean back. We'll just get her done. I promise you're going to be okay. You got it. There. You okay?
Oh,
Good job.
yeah, that hurts.
Oh. All right. Grabbing your lip, huh?
Yeah.
Yeah, we'll wait.
Shut up.
She's telling somebody else to shut up just so everybody knows. Is that your sister?
Uh-huh.
Twin, okay, twin. I guess she's allowed to tell you that. Yay. Okay, we're moving along. You survived. What do you think?
I like it. I like it.
Alrighty, I'm going to get fresh gloves on and we're moving along.
You got this.
All right.
Oh, yeah.
And you can pretty much eat whatever you want, but you cut it up small before you put it in your mouth. Like, don't bite into a hoagie or anything.
Ow.
Oh.
What is all going to be eating ice cream?
The reason it hurt is I was putting on the gem as super tight as I can because you don't want to go home and lose a piece, right?
Yeah, those don't even stick out that far.
Right. We'll get it real quick. It'll be okay. I'm going to push you that way just a little bit. There you go. A little bit of a bleeder today, huh? Not too bad, though. We'll get it. Okay, take a look at that one. And we'll move on. Like it? Okay. These usually hurt pretty much, don't you think that hurt a lot?
Yeah.
Yeah, compared to like anything else, that's pretty bad, huh?
You didn't flinch like you did in your nose, though. But maybe it's just because your eyes watered and everything with your nose.
I'm gonna take a look. Woohoo!
Your
Good.
brain's gonna start leaking on all this whole.
Erika in the chair, she's getting a Tragus. She's kind of like on the fence of whether she should just leave, but I think she's gonna do it, right? Yeah. Yeah, okay. Lean back all the way. There you go. Well, you're not gonna lose that gem, let's put it that way. It's on really good. Turned out perfect. We'll just clean it off real quick with a Q-tip. Don't look yet.
Ooh, yeah, that's cute.
You like it?
Yeah.
All right, let's leave it at a size 3. And then right here's our extra room for swelling. You know the drill. We'll shorten it soon. Danielle, she's getting 4 microdermals. Then we're going to start with the first one.
Face? It's just weird.
Yeah, that's a weird one. Weird digging feeling, huh?
The one was like really sore,
So I took it out and like soaked my jewelry and then gave it a good clean, took a shower. And I left for work and I forgot to put them back in. And you were at work, were like, oh crap, right? Yeah. Yeah. Not gonna lie, your skin's a little bit tough right there. Yeah. I figured. Yeah. I mean, it's not where you had the surface bars even, so we can't blame scar tissue. Yeah. It's just your skin is kind of tight right there.
Randomly will get sore.
Yeah, that's strange. I mean, I would have... You can only guess that maybe they're better at something right or left-handed or something, or I don't know, but I mean, I'd use my right hand on both. I don't know. I don't know. Yeah. Wow, here we are bleeding. No, the other one was fine. This is another tough one. It's just like your skin is like, nope, not going there. So I got a girl that works for me, Angie. She's really tough with this stuff too. You remind me of her. She's really like just kind of chill as I'm massacring her, you know.
Very zen.
Yeah. Perfect. And another toughie.
I was saying that one looked tough.
Yeah, she definitely is one of the tougher skinned girls I've stuck a thingy in. That's so technical, isn't it?
It must be like the top one. I don't know.
It just doesn't want to give me anything to work with, but we got it.
I heard this on one. Yeah, I've heard about this one.
Anybody that can handle surface bars can handle these, and you've done that before.
Yeah, twice.
So we're going to make a dot. I actually mark out further than you would think, and then it makes sense later, and you'll see why. It looks like it's real far out on the tip. And there's a little tiny capillary snaking into the middle here, but that's okay. I mean, I'm not going to hit it anyway. Even if I did, a capillary is not a big deal. It's just going to have a little bit of bleeding, and then it'll be fine. The main, you know, veins are off to the side. And now what we're going to do is look in the mirror and bite the dot, basically. Don't try to bite the dot, just like bite where the dot is. Is it in the crack of your teeth in the exact center when you do that, in your opinion? Yes? Curl the tongue and bite and see the bottom. Your tongue is back in your mouth. Open, but don't stick it out. Yeah, see how her tongue has the dot right in a good spot? We wouldn't want it back here, you know, geez. You know, so the tongue is stretchy. You mark it out here, it goes back in the mouth, and then it's right where it should be. Very good. There's that. And we're looking at the bottom, nice and even, right and straight. And then just stick it out as far as you can for a second. And we're gonna cork that real quick for safety. Just a quick cork. And then if you give me, after it's in, you give me 3 seconds and I'll put the bottom ball on and you'll be done. There you go. I'm gonna tighten it down real good and then back in the mouth. And then you relax here and we're gonna take good care of you. Yeah, get her one anyway. Even if she says no. Just because we want her to relax. Oh, I'm so proud of you, Paige. Good job. Paige was very nervous prior to having this done. On a scale of 1 to 10, I think she was like an 8.
Yeah.
Yeah.
Probably like closer to 10.
I hate to put numbers in your mouth, and you know, but she said closer to a 10. She was really scared, but now you're fine, right? Okay, cool.
Yeah, it wasn't bad. I actually think my cartilage was probably worse.
Awesome. Oh my gosh, I'm so glad you tolerated it so well. She did it.
22.
And Marley said, do it, do it. Right, Bubba? Are you happy too? Okay, Bubba's proud of you too. She's gonna get Tragus piercing. Does not seem nervous, right?
Right.
Okay, cool. Both of these girls seem pretty tough today, so.
I have so many tattoos, and it's like,
Yeah.
yeah, you don't
I've
even.
sat for like hour and a half tattoo.
Don't move. Alright, I gotcha. You did move a little bit, but we got you. That's okay. I mean, did you feel like you just, I don't know,
I don't know.
felt like you had to move?
I
I should have said don't move
Yeah,
your head.
well,
I could have
didn't-
warned you, right?
I didn't know you were starting like right when you did.
Oh, okay.
Sorry.
No, don't be sorry. It was my fault for not saying, okay, don't move your head. Let me give you a spray.
Oh, I can feel it.
Oops,
The
there.
blood going down my
Look, my Girl Scout skills are really sucking today. Catch that blood, Lisa. Go ahead and take a look.
Oh, I do like that.
Good. Are you ready for it?
Yeah.
All right. Boop.
Small nose like me. Everybody says that. Not the small nose.
Yeah, right there. Let's take a look in the mirror, though.
That's cute. You see it?
Good. Okay. Glasses off. Sitting up real tall, close to me. Head back all the way. You want to hold her forehead?
My heart's beating
Close
so
your
fast.
eyes. Just
It's
close
not
your
that
eyes.
bad. Just relax. Think about your left foot. Which one's your left foot?
One,
There you go. Got her thinking about something. Did you figure out which foot it was?
Hold.
All done, buddy. Good job.
what do you say?
How do you rate that one? Was it pretty bad?
Was it bad as your Cartland?
Yeah, it was worse.
Okay.
Just a little though.
Can I get the purple dot off the side of it? Just a little smeared, so I'll get it off.
I can feel the thing on my nose.
There are flatbacks available for people who don't like the screw. What do you think?
I like it.
It looks really cute on you.
Thank you.
You did pretty good. Cindy's getting a nose piercing. Do you want someone to hold your head? 'Cause sometimes it helps. That way you just know you're gonna hold still for 1 second. Don't move. Good job. You can let go of the head now. She's got it.
Whoa. She says, whoa.
I think putting the thing in, I think that hurts more.
You did?
Yeah.
Hold on. 'Cause that one fits a little loose.
Oh, good. Okay.
Just in case.
Thank you.
So, yeah, I mean, if it's not needed, then you can shop for a new nose ring at an appropriate time. But until then, I would leave that in there.
How long does it take for it to heal?
Well, you gotta look around 2 months and check it. Some people are looking good, some people need another couple months. But 2 months is a time when you're like, how's it looking? Healed or not?